I am Dr. Pramod Nadkarni, consultant cardiologist working in Pune. Today I am going to discuss regarding ways to control the blood pressure. So there are many ways to control the blood pressure. First and foremost important is increasing the physical activity, increasing the exercise day-to-day exercise level. So it is recommended to exercise at least 30 to 45 minutes per day, that means 150 minutes per week with a moderate level. So moderate exercise means you can walk, you can do just brisk walking per day. If a person likes to do a vigorous activity, vigorous exercise like running, jogging, at least 75 minutes per week you should do the vigorous activity. So this regular exercise has shown that there is a decrement of 10 to 15 millimeter of mercury of blood pressure in this person. Second most common way to decrease the blood pressure is having an adequate weight, optimum weight for that person. That means if you are overweight, you should lose the weight. Decreasing weight by 5 to 10 pounds can decrease the blood pressure by 3 to 5 millimeter of mercury. So it is recommended that the men should not have a waist more than 40 inches and female should not have a waist of more than 35 inches because it can prone the patient for hypertension and its lethal effects. Other important way to decrease or control the blood pressure is having an adequate healthy diet. So what diet a hypertensive patient or person who is prone for hypertension should have? They should have a low salt, high potassium, high fiber and low calorie, low carb diet. It should be high in the protein. Why this? Because this decreases the tension in the arterial walls and it decreases the blood pressure by 4 to 6 millimeter of mercury. This diet has shown improvement in the personal physique as well as the physiological condition of the cardiovascular system. Another way to decrease the blood pressure is to stop having habits which can cause hypertension. Smoking is the most notorious habit which has shown a deleterious effect on the vessel wall and that can cause hypertension and many cardiovascular events. So smoking, active as well as passive, can cause deep inflammation and hardening of the arterial vessels and increase in the blood pressure. So it that way can cause various lethal effects of the hypertension. So stopping smoking can prevent the person from having a complication of a hypertension. Alcohol is also in an excess amount can cause a deleterious effect on the blood vessels and heart and it can prone the patient for hypertension. So having excess alcohol is also a lethal thing. Then a person should avoid canned foods or preserved foods as they are more in salt. So excess salt is added in these canned foods or preserved foods, so we should avoid this food to decrease the blood pressure. The most common, most important thing nowadays in young adults which has made them prone for having a hypertension, or there is increased incidences of hypertension in young people because of the day-to-day increase in the stress level in their life. So how to decrease the stress? Stress is the major factor in most of the hypertensive patients, which they can decrease by doing many behavioral and exercises, like they can do deep breathing exercises, group discussion among their peer groups regarding their problems, behavioral modification to the stress level, yoga, meditation. All these manuals can decrease their stress and they can have a normotensive life. They can have normal blood pressure and they can prevent themselves from getting complications of hypertension. And lastly, if the person is not getting control with the blood pressure, they should consult a doctor and get a proper treatment for the hypertension. If they need medications for controlling the hypertension, they should have a regular follow-up, they should have a regular test with the doctor, and they should not stop the medicine unless it is advised by the doctor. Thank you.